Hi, my name is Cherie, and I'm a physiotherapist at Glen Hunley Road Physio. And we're just here to talk today about some postural advice. I have a lot of patients sitting long hours, and they get a lot of neck and back pain, and they have lots of questions about what posture to use at work and what positions they should be in. So I just thought I'd give you a little bit of advice today. The latest research shows that it's not really about staying in one perfect posture all day. It's more about dynamic posture or about changing up your posture. When we're talking about ideal sitting position at your desk, you want to use your backrest. A lot of my patients, they get really sore backs because they're forwards in their chair and they're leaning forwards all day like this around their computer. So the main thing you want to do is you want to try to sit right in the back of your chair so that you can actually lean back into your chair, and that way your back muscles aren't on all day trying to hold you up. And then you want to bring your chair really close to your desk so that you can continue to lean back and use your keyboard with your elbows in at your sides. And also, you don't want to be reaching very far forwards for your mouse, because that can get you sore in the shoulder and the neck. Again, you want to keep your elbow in at your side when you're mousing and trying to lean back into your chair. So if you're finding that you're looking down at your screen or you're looking up at your screen, that'll also make your neck quite sore. You want to have the top of your screen in line with your eyebrows. So you should be able to see right at the top of your screen, and that way you don't have to look down or look up for prolonged periods of time. You're keeping your neck nice and straight, or neutral, as we like to call it. A lot of patients ask me about lumbar supports and what kind to use and where to put them. So we have great little lumbar rolls that are portable. That's a good aspect of back supports, is you can actually change them if you change your chair. So sometimes people put them right down here near their sacrum, which is incorrect. They need to go in the small of your back, where that normal inward curve of your low back is, just kind of nestled into that curve. And then you want to be able to lean back comfortably into it. Okay. Also, if you're noticing that that starts to get sore, you just take it off and sit like that for 20 minutes. That starts to get sore, you pop it back on, you sit like that for 20 minutes. Again, just trying to constantly be changing your posture and changing your position to get that dynamic posture in throughout the day. A really easy back stretch I like to show my patients, just to give them a bit of a postural break during work, is called a sky reach. So all you do is you stand up, nice and tall, you reach for the sky, and when you're reaching, you're imagining that you're pulling your shoulders out of their sockets. You take a deep breath in. As you're breathing in, you're imagining you're lifting your rib cage off of your hips, and then all the way out. You do this 3 times. Lift it up, big reach, all the way out, but I would say that you want to avoid sitting for longer than 30 minutes. And when you're breathing in and lifting up, you'll just feel all of those muscles in your low back stretch up and lift away from your pelvis. I like to give extension types of stretches as postural breaks, just because extension is usually what people are lacking. So another one, especially for the upper back, if you have desk work, which you're like this all day, a lot of people get really rounded in their upper backs. So I like to do the opposite movement of that. You place your hands behind your head just to support your neck. You open your elbows out wide, and you just lean backwards over the back of your chair. And again, take a deep breath in, all the way out. Sink into the stretch. Again, all the way out. Do it 3 times. And then back to sitting. And again, if any of these stretches cause you pain, stop and come see a physio. If you're finding quite a bit of tension developing in your neck, you can do a few neck stretches throughout the day. So a big muscle group called your upper traps or your upper trapezius gets really tight. It inserts from your neck to your shoulder. Basically what you do is, if it's the left side of your neck that's sore, you use your left hand to grab onto the bottom of your chair. Then you anchor your shoulder down towards the floor. You tilt your head to the right until you feel the pull down the side of your neck, and you can gently add a little bit of pressure with your other hand. Don't pull too hard, your neck is very delicate. You just want to feel a gentle stretch, and you hold that for about 30 seconds. If you start to feel pins, needles, or burning or shooting pain in the arm and the hand, just ease off the stretch a little bit. And then you come back to center, do some backward shoulder rolls. A great option is also portable standing desks. They're just attachments that you can place on top of your desk that easily extend up so that you can stand at your desk. Or if you need to give your legs and your back a bit of a break, you can push it back down so that you can sit at your desk again as well. If you don't have a standing desk, I would say just try to stand up and stretch and move around. I would say at least every 30 minutes. So if you're experiencing neck or back pain or have any further questions about your posture, please contact me at the clinic or call and make an appointment.